If your body could send you a warning text before something serious happened, your penis would probably be first in line. And most men completely ignore the message. The truth is, your penis is not just about sex. It's a live health monitor connected to your blood flow, hormones, nerves, stress levels, heart health, even your emotional state. And sometimes the smallest habits, the ones men laugh off or never talk about, quietly create damage that takes years to reverse. I'm Dr. Ava, urologist and pelvic surgeon, and today we're talking about the 10 biggest mistakes men make with their penis. Mistakes that can affect erections, fertility, confidence, intimacy, and long-term health. Some of these are surprisingly common. One of them sends men to emergency surgery every single year, and another most guys are doing without realizing the damage it causes. So stay with me until the end, because number 10 changes the way most men think about sexual health completely. Now let's start with the mistake that sounds simple, but reveals more about your body than most people realize. Number 1, ignoring your penis. A lot of men think erectile problems are just getting older, but medically, that's not how we see it. In many cases, erection quality acts like an early warning system for the entire body. Why? Because erections rely on healthy blood vessels, healthy nerves, balanced hormones, good sleep, stable mental health, and proper circulation. So when erections begin changing consistently, the penis is often detecting problems before the rest of the body notices them. I sometimes tell patients this: the penis is like the smoke detector of men's health. It usually sounds the alarm before the fire spreads. In fact, men with erectile dysfunction have a significantly higher risk of future cardiovascular disease. Not because the penis is weak, but because the blood vessels there are incredibly sensitive. Tiny circulation problems show up there early. So if your erections suddenly weaken, your libido crashes, or things feel different for months at a time, don't just ignore it and hope for the best. Your body may be trying to start a conversation with you. Now the second mistake, trying dangerous DIY penis fixes. Gentlemen, the internet has become the wild west of penis advice. And unfortunately, desperation makes people vulnerable. Every week there's some new miracle trick. Apple cider vinegar, strange oils, stretching routines, homemade enlargement devices, and almost all of them share one thing in common: no real evidence and very real risk. I've seen men permanently injure themselves trying to increase size or improve performance. One of the most common examples is something called jelqing. That's where men repeatedly stretch or squeeze the penis, hoping to make it larger over time. But biologically, what's often happening is microscopic injury, tiny tears, scar tissue, damage to blood vessels, and eventually, erectile dysfunction. The dangerous part is that the damage doesn't always happen overnight. It accumulates quietly, like bending a paperclip over and over until one day it snaps. And then there are homemade constriction devices. I've seen men use metal rings, plastic bottle caps, construction hardware, things never meant to go anywhere near human tissue. One patient needed emergency tools from the fire department because the swelling became so severe the ring could not be removed. That's not a joke. That's real life. Please understand this. If something sounds extreme, painful, or too easy to be true, your penis is probably not the place to experiment. Now, number 3, poor hygiene or overcleaning, and both can cause problems. For uncircumcised men especially, cleaning beneath the foreskin matters because moisture, bacteria, and skin buildup can accumulate and lead to inflammation or infection. But here's the twist. Some men go too far in the opposite direction. Aggressive scrubbing, harsh scented soaps, chemical-heavy body washes. The skin of the penis is delicate tissue. It's not meant to be treated like a dirty frying pan. Overwashing can irritate the skin barrier, create tiny cuts, dryness, burning, and sensitivity. So keep it clean, but gentle. Warm water, mild soap if needed, no aggressive scrubbing. And if you cannot retract the foreskin comfortably or notice unusual skin changes, pain, sores, or persistent redness, talk to a doctor early, because early treatment is almost always easier than delayed treatment. Now, number 4, and this one can become dangerous very quickly. Ignoring pain or warning signs. Men are incredibly good at postponing medical care, especially when it involves intimate areas. I understand why. There's embarrassment, fear, vulnerability, but I've seen men ignore symptoms for months because they hoped the problem would just go away. Blood in the urine, painful erections, ulcers, lumps, discharge, severe curvature. These are not things to silently negotiate with in your head. Sometimes it's an infection, sometimes inflammation, sometimes something more serious. And yes, penile cancer is rare. But when it does happen, early detection changes everything. I've seen men delay care so long out of fear that the eventual treatment became far more aggressive than it needed to be. Fear grows in silence, but medically, earlier action almost always creates better outcomes. Now, before we get to number 5, which might save some men from emergency surgery, if you found this helpful, hit the like button, subscribe to the channel, and share this with someone you care about because the right information can change someone's life. Now, number 5, losing control during sex. Nobody talks about this enough. One awkward movement during vigorous sex can actually fracture the penis. And yes, penile fractures are real. When an erect penis bends forcefully during intercourse, the outer layer surrounding the erectile tissue can tear. Most men describe hearing or feeling a pop, followed by swelling, bruising, pain, and immediate loss of erection. It's a medical emergency. And emotionally, it can be terrifying. Not just physically painful, but psychologically shocking. Many men panic because they associate erections with masculinity, confidence, intimacy, identity. Suddenly, something feels fragile. This is why staying controlled during sex matters. Rough doesn't always mean better, and lubricant helps tremendously. Not because something is wrong, but because friction and poor angles increase injury risk. Good lubrication protects tissue, reduces strain, and often improves pleasure for both partners. Now, number 6, overheating your testicles. Most men never think about temperature affecting fertility. But there's a reason testicles exist outside the body. They require a cooler environment for healthy sperm production. Excessive heat from hot tubs, steam rooms, laptops directly on the lap, or constant heat exposure can interfere with sperm quality and potentially testosterone production. Think of the testicles almost like a temperature-sensitive laboratory. When the environment overheats consistently, production quality suffers. That doesn't mean you can never enjoy a hot tub. But moderation matters. Small habits repeated daily shape biology over time. Now, number 7, being too rough during masturbation. This is more common than people realize. Some men train their nervous system to respond only to intense pressure, speed, or grip strength that no partner can realistically replicate. Over time, the brain and body adapt to that specific stimulation pattern. Then intimacy with a real partner suddenly feels less stimulating by comparison. This can create frustration, shame, confusion, and performance anxiety. So when I say be nice to it, I mean this. Slow down. Use lubrication. Remove shame from the experience. Your nervous system remembers patterns. Healthy stimulation patterns support healthy intimacy later. Now, number 8, smoking and neglecting overall health. Gentlemen, smoking is one of the fastest ways to damage erectile function because erections are fundamentally a blood flow event, and smoking damages blood vessels everywhere in the body, including the small, delicate arteries supplying the penis. I've had men spend thousands searching for sexual performance solutions while continuing the exact habits destroying circulation underneath. The penis doesn't exist separately from the body. It reflects the body. So movement matters, sleep matters, diet matters, stress matters. Aerobic exercise improves circulation. Resistance training supports testosterone. Healthy sleep regulates hormones. Chronic stress floods the body with cortisol and adrenaline, which can suppress libido and interfere with erections. And no, lifestyle improvement is not flashy advice, but biologically, it works. Small daily habits quietly become future health outcomes. Now, number 9, being cruel to yourself mentally. This may be the most underestimated issue of all, because once a man experiences difficulty sexually, even one time, many enter a loop of fear. The next encounter becomes a test. What if it happens again? That thought alone activates stress pathways inside the brain. Adrenaline rises. The body shifts into performance mode instead of pleasure mode. And erections do not thrive in fear. Then one bad experience becomes 2. 2 becomes anxiety. Anxiety becomes avoidance. I've watched confident men completely lose trust in themselves because they interpreted one temporary issue as permanent failure. Please hear me clearly. Fluctuations happen. Stress happens. Fatigue happens. Life happens. Your worth is not measured by one moment in the bedroom. And finally, number 10, use it or lose it. This phrase sounds dramatic, but biologically, there's truth inside it. During sleep, healthy men normally experience several erections every night. These nighttime erections help oxygenate penile tissue and maintain healthy elasticity and blood flow. But when erections stop happening consistently over time, tissue health can gradually decline. Some men even notice shortening or curvature changes later. And beyond the physical side, avoiding intimacy for long periods can slowly reduce desire itself. The brain adapts. Humans are deeply wired for connection, touch, affection, intimacy, not just orgasm, connection. That's why maintaining emotional and physical closeness in relationships matters so much at every age. Not perfectly, not constantly, but intentionally. Because intimacy is not just about sex. It's about vitality, confidence, partnership, emotional health. At the end of the day, your penis is not separate from the rest of your life. It reflects your circulation, your stress, your habits, your confidence, your emotional well-being. So taking care of it is not vanity, it's healthcare. And the good news is this: most of the damage men fear does not happen overnight, which means small improvements made consistently can create powerful changes over time. Better sleep, better communication, less stress, more movement, more awareness. That's how confidence quietly returns. So if this video helped you, subscribe to the channel, turn on notifications, and share this with someone who might need to hear it. And let me ask you one final question. Which of these mistakes do you think men ignore the most? Drop it in the comments below. I am Dr. Ava. Take care of yourself. Protect your health. Protect your peace. Because your body is not your enemy. It's your lifelong teammate, and you are absolutely worth taking care of.